Hello, my name is Taylor Nelson. I am doing a head-to-toe assessment for Presentation College. This is my patient AJ. His birth date is 5/27/1993. I provided privacy and I also washed my hands. AJ's level of consciousness is alert and oriented to person, place, and time. AJ's mental status and mood status is good. His hygiene is clean. His posture is good. His gait was good when I watched him walk in. His ability to hear and speak is also within normal limits. Throughout the assessment, I'm going to be looking at AJ's skin for color, turgor, temperature, texture, also for moisture and any lesions. All right, to start the assessment, I'm going to assess his scalp for anything unusual. I'm looking at the skin and cranium. All right. I'm looking at his facial features. I'm testing cranial nerve number 7. I'm just comparing each side to each other, making sure one side looks the same as the other side. All right, so I'll have you smile, frown, puff your cheeks, and raise your eyebrows. Good. So throughout those 4 times, each side of your face, or both sides of your face, were the same as each other. All right, so I'm going to check the sinuses, the maxillary, and frontal. Any pain or pressure when I do that at all? Okay, checking the temporal artery, and then checking for TMJ. I'll have you open your mouth, and then wiggle it from side to side. Good, and I don't feel or hear any grinding or popping. Did you feel any pain with that? No, okay, good. All right, so I'm gonna move on to the eyes. I'm just looking at your eyelids and your eyelashes, making sure that they're both symmetric, making sure that there's no lesions. All right. I'm going to look at the cornea, sclera, and iris, also your conjunctiva. Your conjunctiva I'm going to pull down on the eye and also pull up. All right. I'm going to check the corneal reflex, which is checking cranial nerve 3, 4, and 6. I'm going to just shine the light right in the center of your nose, and I'm just looking at where the light lands on each eye, okay? I'll just have you stare at me. Good. And the light reflection shines in the same spot on both eyes. So we're good there. All right, so I'm going to check the pupils. Good, and your pupils were both equal, round, reactive to light. And I'm also going to check the accommodation. So I'll just have you stare at my finger. Good, and your eyes were both accommodating. All right, so now I'm going to check the visual fields. So this is going to be cranial nerve number 2, okay? I'll just have you cover your right eye with that note card, and I'll cover my left eye. I just want you to tell me when you see my finger come into your visual field, okay? All right.
Yeah. 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 Yeah.
Good. Perfect. All right, now I'm going to check your extraocular muscles. So I just want you to follow my finger with your eyes only. Good, that was great. All right, now I'm going to check your vision. So I'll just have you start at the top and work your way down, saying the numbers that you see, okay?
9, 5, 8, 7, 4, 2, 8, 4, 3.
Perfect. All right, and then checking your red reflex. So I'll just have you stare at the back wall. All right. Good. And perfect. All right, I'm going to move on to your ears. First, I'm just going to inspect each ear, making sure that they're both the same and symmetric. Okay, now I'm going to palpate, making sure that there's no lumps. Any tenderness at all when I do that? No. All right, good. I'm going to feel for some lymph nodes. I have the preauricular lymph nodes, posterior auricle lymph nodes, sternomastoid node, retropharyngeal node, superior superficial clavicle node, anterior superficial clavicle node, submental node, sublingual node, submandibular node, facial, and parotid. Any tenderness with that at all? No? Okay, good. I'm going to move on to the whisper test now. I'm going to whisper a word, and you repeat back to me what word you hear, okay?
Chair.
Baseball.
Baseball.
Great. All right. Now we're going to do that, what's called the Weber test. I'm going to put this on top of your head. Let me know when you stop hearing the vibration, okay?
No.
Perfect. All right. And did you hear that in both ears or just one?
Both.
Both. Good. I'm going to move on to the Rhine test. I'm going to put this back behind your ear on the mastoid process. Let me know when you stop hearing the vibration.
No.
All right. And I'm going to hold it in front of your ear. Let me know when you stop hearing the vibration.
No.
Great. All right. So air conduction was twice as long as bone conduction, and that's exactly what we wanted. We're going to do the same thing on the right side.
No.
Great.
No.
All right. Great. Air conduction twice as long as bone conduction. And then go ahead and take a peek at the inside of your ear, looking at the tympanic membrane. All right. I'm going to pull up on the auricle. Good. Look in the left ear. Great. So both ears, the tympanic membrane was pearly gray, shiny, no redness or bulging, okay? All right. So now we are going to move on to the nose. I'm just going to start by inspecting the nose, okay? I'm looking at both sides, making sure that it's symmetrical from each other. I'm looking at the middle of your nose, okay? Making sure that's not deviated, the septum. All right, I'm going to take a peek inside your nose. I'm looking at the mucosa, the septum, and also the turbinates, okay? All right, and your turbinates are dark pink, so that's great. Turbinates, dark pink, that's what we want. All right, now we're going to check the patency of your nostrils. I'm going to press on one side of your nostril, just breathe out on the other side, okay? Good. Great. I'm going to be checking cranial nerve, number 1. This is a familiar smell. I'm going to put it underneath your nose. Let me know what scent you smell, okay?
Coffee.
Great. All right. So now we are going to go ahead and move on to the mouth. I'm just looking at the outside of your mouth, making sure that both sides are symmetrical from each other. I'm going to change the tip on my light here, and I'm going to inspect the inside of your mouth. I'm looking at both sides and as well as your tonsils, okay? Great, and neither sides have lesions. I'm looking at your tonsils here, and they are not enlarged. All right, we're going to be checking cranial nerve number 9 and 10 next, okay? I'm going to be checking your uvula, so I'll have you stick your tongue out and say ah. Great. And next, we are going to be checking cranial nerve number 12, so I'll have you stick your tongue out, and I'm just looking at both sides, making sure that your tongue is symmetric from each other. Great. All right, moving on to your neck. I'm just inspecting, making sure that the trachea is in the center. Great. And then I'm going to look at your jugular veins, make sure that they are not distended, okay? Good, and I do not see any distension. Great, and I don't see any distension on the right side either. We're going to do some cervical range of motion, so I'll just have you move your head back, to the side, down, to the side again, and then all around. All right, any pain or tenderness with that? No, okay. I'm going to palpate the trachea next, making sure that it's not deviated. I'm just feeling on both sides here. Great. I'm going to check for the lymph nodes. Do not feel the lymph nodes. I don't feel the thyroid gland, so that's good. I'm going to feel for the carotid artery. carotid artery on the right side. Great. All right, so now we're going to test the muscle strength of your sternomastoid muscle as well as the trapezius, okay? So I'm just going to press down and you'll just press up with your shoulders. There you go. All right, great. And lastly for the neck, I'm going to check for a carotid bruit. Also checking that muscle strength, that was checking cranial nerve number 11. And I did not hear any swooshing sounds with that, so that's great. All right, so moving on to your upper extremities. First, I'm going to start with the range of motion of your shoulders, okay? Actually, we are going to do the something called sterognosis. I'm going to put a familiar object in your hand and you're going to tell me what object you feel, okay? So I'll have you stick out your hand and close your eyes for me.
Going.
Great. And then the next thing we are going to be testing is called graphesthesia. I'm going to draw a number on your hand. Just let me know what number you feel, okay? Have you close your eyes? 9. Great. All right. So now we're going to check the range of motion of your shoulders. So I'll have you arms out, abduct them, adduct them, and behind your head, and then down, back, behind your back. Great, and then I'll just have you shrug your shoulders. Good. All right, so now we're gonna check the range of motion of your elbow. I'll have you, out, and in, great. And then the range of motion of your wrist, and then to the inside and outside. All right, and then range of motion of your fingers. Great, and then I'll have you touch each finger to your thumb, and then back again. All right, great. So now we're gonna test muscle strength of your deltoid, all right? So I'm gonna press down, and you're gonna, yep, great. All right, we're gonna test the muscle strength of your bicep and tricep next. So I'm going to hold back here. We're gonna test bicep first. You're gonna pull towards yourself. Good. And then tricep, push towards me. Great. We'll do it on the other side. Bicep, pull towards yourself. Tricep, push towards me. Good. And then of your wrist. So I'll have you, actually for the wrist, we're going to have you squeeze my fingers. Great. And I'm just testing that muscle strength. And then I'll have you hold out your fingers. And then I'm gonna try to squeeze your fingers together. You're gonna try to keep them open, okay? All right, great. Moving on from that, I'm gonna check some pulses. So first I'm gonna check for the brachial pulse. Good, and then the radial pulse. Good, and the brachial pulse on the right side and the radial pulse on the right side. Good. All right, now we are going to test some reflexes. So first we're going to do the bicep, good, and the tricep, good, and then the brachioradialis. Have you relaxed your arm on me? Yep, perfect, good. And then the bicep, I'll just have you relax your arm, good, tricep, good, and then the brachioradialis. Perfect. We are going to test some sensations. I'll have you close your eyes. You're going to feel either sharp, soft, or vibration, okay? Let me know which one you feel. Hands.
Soft. Sharp. Vibration. Vibration.
Yep.
Sharp. Soft.
Perfect. All right. So moving on from that, we're going to do posterior chest. So I'll have you go ahead and lay on your stomach. So I'm just inspecting your back, making sure that it is rising and falling as it's supposed to, making sure that it's symmetric on both sides. Good. I'm checking the spinous process, making sure it's straight. Good. And I'm going to palpate for any tenderness or any bulges. No bulges are felt. Was there any tenderness at all?
No.
No? Okay. I'm going to check for thoracic expansion, so I'll have you take a nice deep breath. Another deep breath. And one more deep breath. And we're going to do actually one more. Good. Now we're going to check for tactile fremitus. I'm going to have you say 99 4 different times. Okay? Yeah, say 99.
99. 99. 99. 99.
Great. All right, so I'm going to go ahead and just percuss. I'm just listening for different sounds. Great. All right, I'm going to check for CVA tenderness next. Let me know if you have any tenderness with this, okay? Any tenderness?
Nope.
Okay. And then any tenderness?
Nope.
No. Okay. I'm going to go ahead and auscultate. You take a nice deep breath for me. Great. All right, so that finishes up the posterior chest. So I'll have you go ahead and roll over onto your back. I'm going to check the anterior chest. All right, so first I'm just going to inspect. I'm making sure that the chest is symmetric on both sides, making sure it's rising and falling as it's supposed to. Great. All right, I'm checking for any retractions. I think I don't see any. I'm going to go ahead and I'm going to palpate for the point of maximum impulse. This is on the left midclavicular line, fifth intercostal space, okay? All right, so right here. Great. Okay, I'm going to check for chest expansion now. Let me take a nice deep breath. Great. I'm going to check for tactile fremitus next. I'll have you say 99 4 more times.
99. 99. 99. 99.
Great. All right, so I'm going to go ahead and I'm going to check for the axillary lymph nodes. Good, and I did not feel any, so that's good. Breast self-exam, you'll want to do this once a month. You'll want to pick the same time each month. You can do it in a couple different ways. You can either do it in the circular motion, you can do it at starting at the inside and working your way out, or you can do what they call the lawnmower way. You work your way down and then back up and down and back up, making sure you're not missing any areas. If you notice any lumps, anything unusual that you hadn't noticed before, let your doctor know as soon as possible, okay? All right, so I'm going to go ahead and I'm going to percuss, just listening for different sounds. All right, I'm going to go ahead, I'm going to take a listen. Nice deep breath. Okay, and one more. Great. I'm going to go ahead and I'm going to listen to your apical pulse for 30 seconds. Great. All right, I didn't hear any abnormalities. Your heart rate was regular. I'm going to go ahead and I'm going to check 5 different positions. I'll let you know what positions I'm listening to, okay? So first is the aortic, pulmonic, Erb's point, tricuspid, and mitral. Great. I'm going to go ahead and I'm going to listen to those same 4 spots, but with the bell of my stethoscope this time. That's aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, great. I'm going to go ahead and I'm going to move on to your abdomen. I'm just going to lift your shirt up here a little bit. First, I'm going to start by inspecting. I'm looking for any pulsations, any deviations, I'm looking at the skin around your umbilicus, and I'm also just looking for any deviations. Great. I'm going to go ahead. I'm going to auscultate next. Just going to listen to all 4 quadrants. Good. So it was active times 4, so it was active in all 4 quadrants, okay? Nothing hyperactive or hypoactive. Next, I'm going to listen for an aorta bruit, okay? And I didn't hear any swooshing sounds, so that is good. We didn't want to hear it. I'm going to go ahead and I'm going to palpate next. I'm just going to lightly palpate all 4 quadrants. Any tenderness at all?
No.
Right, how about now?
No.
I'm going to go ahead and I'm going to deeply palpate all 4 quadrants now. Any tenderness so far? Okay, and how about now? Okay, I'm going to go ahead and I'm going to percuss all 4 quadrants, just listening for different sounds. All right, good. I'm going to move on to the inguinal area. First, I'm going to palpate for the femoral pulse. I'm going to do it on both sides. Good. And good. All right. Next, I'm going to feel for the horizontal and vertical chain nodes. And I didn't feel them, so that's good. A testicular self-exam, you'll want to do this once a month as well. You can do this in the shower, same time as your breast exam when you have warm, soapy hands. Just grab, do 1 testicle at a time. You'll grab it with your fingers, with your thumb on top, and just kind of roll it around looking for any lumps, anything that you hadn't noticed before, okay? Just let your doctor know if you see anything unusual. I'm going to let them know right away. All right, so we're going to go ahead and move on to the range of motion of your hips. So I want you to go ahead and just scoot your body up so that way your legs are on the table. You can sit up. All right, so we'll go ahead and I'll lift your leg up, down, out, in. Good. Up, down, abduct and adduct. Okay, we'll do your knee now. You're going to go ahead and bend it. Good, and then to the inside. Good. Up, down, inside. Good, and then we'll do the range of motion of your feet. Up, down, out, in, up, down, out, in. Okay, and then I want you to, we're going to do what's called a heel run. You'll take your right heel and run it down the tibia of your left leg, okay? Great, and then the opposite. Perfect. All right, so now we're going to check the muscle strength of your hips. So what I want you to do is actually roll around back onto your stomach. Okay, and I'm going to press down on your hip or on your leg as you try to lift it up, okay? Lift it up. Good. And then we'll do the same this side. I'll have you lift your leg up. Good. All right. I'll have you go ahead and sit back up. We're going to check the muscle strength of your quad and hamstring. So I'll press up, or I'll press down as you press up on your leg. Great. And same for this side. Good. And then checking your ankle and your feet for muscle strength. So I'll have you step or stand up, and then you'll walk on the outsides of your feet. Good. And then on the inside, I'll have you come back and walk on the insides of your feet. Good. And then I'll have you turn back around and I'll walk. I'll have you walk on your heels. Good. And then on your tiptoes back this way. Good. Okay, I'll have you take a seat again. Next, I am going to check the popliteal pulse. Good. The tibial pulse. And the pedal pulse. Okay, and on the other side, the popliteal pulse. Tibial pulse. And pedal pulse. All right, perfect. Next, I'm just going to check your reflexes. So first, we're going to do your patellar reflex. Good. And your ankle. Good. Patellar. And ankle. Good. And same thing that we did with your hands. We're going to check the sensations of your feet. You'll feel either vibrating, soft, or sharp. Okay? Let me know what you feel.
Sure. So. Vibrating. Sure. So. Vibrating.
Good. All right. So now what's left of the assessment, we just have to do a few more things. So I'll have you go ahead and stand up. We are going to check the your Romberg reflex. So I'll have you go ahead and close your eyes and stand on one foot. Good. And then I'll have you close your eyes and stand on the other foot again. Great. Okay. Next, I'm going to have you stand at the end of the table here and walk towards the wall, just normal. Good. And then I'll have you come back, walking heel to toe. Great. All right. Now I'm going to do some range of motion with your spine and then checking the alignment of it. So I'll have you go ahead and touch your hands to your feet. Good. I'm just looking at the curvature of your spine. Good. And then I'll have you stand up and then lean to the left. And then the right. And then I'll just have you lean forward and then lean to each side. Good. All right. That concludes our assessment. Thank you.